Today, we're getting under the hood of women's health with Dr. Taniqua Miller, a board-certified OBGYN and women's health physician, empowerment coach, a midlife menopause health expert, and the founder of Revival, a menopause telemedicine company. Dr. Miller trained in psychology at Yale University and earned her medical degree from Harvard Medical School before completing her residency training in obstetrics and gynecology at the University of Virginia. She was on faculty for over a decade at Emory University and worked at the Emory Health Systems. And she's been in practice for over 15 years. Dr. Miller will get under the hood of perimenopause.
Following my residency training when I graduated in 2012, I thought that I would be intimately involved in obstetrical care. It was something that I was passionate about in my residency training and felt that I was good at. But there was one patient that really changed the trajectory of my career path. She was a 50-something-year-old woman who was sent over from the Heart Center where I was practicing at an academic institution. And she was coming in just for her well woman visit. And as part of her care, because she had sustained a heart attack, her nurse navigator sent her to see me. And there was something that was just off about that visit. I felt like her affect was very flat. I felt like she wasn't very engaged in the meeting. And so, me being me, I put my pen and my pad down and just simply asked her, "What's going on? There's something that seems off." That's when she told me her story. She told me that she had been on hormone therapy for pretty debilitating menopausal symptoms including hot flashes, night sweats, lack of concentration, and the hormone therapy really was effective for her. But unfortunately, she had had a heart attack and was immediately taking off all of her options. So here we are 6 months later, and she's had no control of any of the symptoms that she was experiencing. So at the time, I felt like I needed to do something for her. It was clear that her symptoms were impacting her quality of life. And so I kind of dug deep in my brain to pick out a treatment option for her that would be compatible with her history of heart attack, but would also treat her symptoms. And so I went ahead and did that. And then 4 weeks later, she returned. During her follow up, she walked in, the biggest smile on her face. I call it the lipstick sign because she had her face fully made up. And this little intervention that wasn't hormonal really made such a huge difference in her life. And she felt like herself again. At that point, I was hooked. There was no way that such a small intervention that I had just kind of remembered from my training could make such a big impact. And it made me realize that there were a lot of deficits in my own understanding around menopausal health that I really wanted to fill in. And so I started going to conferences and learning more about menopausal healthcare and menopausal physiology, realizing that my own residency training didn't really equip me to take care of people in this transition. And so in 2016, just 4 years shy of when I finished residency training, I became a certified menopause practitioner through the Menopause Society. When we think of menopause, we think of it as the end of periods. And we generally say that is literally a day, a year of having no menstrual bleeding. But the path to getting there is what we consider perimenopause. And on average, that can be 4 years. So while so much of the focus is spent around thinking about menstrual bleeding and when it starts and when it ends, perimenopause can have such a profound impact on so many different areas of the body. Estrogen, which declines during this time, literally has receptors all over the body, not just impacting your periods, but impacting your temperature regulation, impacting mood, impacting joints, and the like. So, one of the common symptoms that most of my patients come to me, they're experiencing vasomotor symptoms, or what we know as hot flashes and night sweats. About 75% of people will complain of those. But believe it or not, that's not the whole story. We see patients who also are experiencing mood symptoms. In fact, we know that for some, this is the time where they have the first diagnosis of anxiety and depression that requires treatment. We also know that we have weight challenges and changes during this time. And we do see over 40% of women complaining about weight gain, especially in the middle section. There's a lot of sexual dysfunction at this time as well, with vaginal dryness or just a general sense of loss of interest. And that can be compounded by Brain fog, lack of concentration, sleep disruption, and joint pain, all influenced by the decline in estrogen. So, one of the things that I truly believe is a gift for people in the perimenopausal transition is education. Once you know exactly what's happening in your body and why it's happening, believe it or not, you can actually experience the transition better. I know that sounds really odd, but it's not that you're not having the symptoms, but understanding through education why things are happening can really empower you and, frankly, improve how you are going through the symptoms. So that's one of the first things that I recommend is really having a full understanding of what's happening in your body. Once you have that, I honestly believe partnering with someone like me, who's a certified menopause practitioner, can really help you navigate some of the challenges that you may experience. And it doesn't always require medication. In fact, a lot of the times, lifestyle modifications can really help. So, for example, if I have patients that their biggest complaint is hot flashes and night sweats, and they're generally feeling okay, but really want to know how they can optimize what they're doing in their own life, we think about triggers. We know that certain foods or alcohol intake can certainly trigger those. And so we stay away from them, believe it or not. I highly recommend having a really great sleep regimen during this time. And I also recommend stress mitigation. And we can do that through mindfulness activities. Cognitive behavioral therapy is also a really useful tool to be able to help with some of these symptoms, but then also exercise. Regular exercise, and the American Heart Association recommends at least 150 minutes a week of moderate intensity exercise. So we're talking about 30 minutes, 5 days a week to help with some of these symptoms. Once I've confirmed menopause on my perimenopausal patients, even on hormone therapy, I generally will make adjustments based on the patient's symptoms. So over time, we may start to decrease the amount of hormonal support that they have, but generally, hormone therapy options are quite safe. And so I really lead with the patient's goals. If we start decreasing medication doses and then we have some breakthrough symptoms, we talk together to see whether or not it's worthwhile to maintain the current treatment plan that we have or to kind of get through the adjustments until things even out again. And so our goal is really to deliver back a little bit of estrogen as the gold standard for those who are candidates for estrogen therapy or desire estrogen therapy, and really balance that with what's happening in their current menstrual cycle. So we know that in the United States, cardiovascular disease, namely having coronary artery disease, increased risk of stroke, and heart attack, are the number one killers of women. And believe it or not, estrogen is protective against that. In fact, premenopause, women have a 50% risk reduction for cardiovascular disease versus men. But as we transition through menopause and those estrogen levels start to decline, our risk starts to rise as well. And so for women who are experiencing perimenopause, so the fluctuations in estrogen levels and even menopause early, their risk for cardiovascular disease rises sooner than those who are maybe going through menopause a little later. We also know that estrogen is protective, especially when it comes to bone health. And we know that the older that we get, as estrogen levels decline, our bone density also has the risk of declining, which can lead to fractures, especially hip fractures that have a 3 to 5% mortality if you're hospitalized, and then can profoundly change independence in later age. And so, if you have patients who are either going through surgical menopause really early or experiencing menopause early, they too are at increased risk of having low bone density as it relates to their bone health. So I just want to share with you a personal experience from my own life that really helps me to guide my patients in feeling empowered in the transition. So when I was a senior in high school, my own mother started having perimenopause. But the interesting thing was is that she was in her late 30s, 37 exactly. I can remember going to stores and she would be so frustrated and irritated and literally rip off her sweater because she would break out into sweats. And at bedtime, she would take off her clothes and go sleep in the living room because it was much cooler. She was a postal worker and worked at nights. And there were times that she actually had to leave work because she was feeling so uncomfortable. And after 6 months or so of going through this, she finally went in to see her doctor. And she was told that she was too young to possibly be going through menopause and that she would benefit from losing weight and stop smoking. So I remember the story, and at the time, dealing with my own teenager angst, thinking that she was a drama queen, but not fully understanding just the isolation and really the disappointment that she was feeling in her own life because no one was listening to her and no one even considered that she was going through menopause. Believe it or not, at the age of 42, just 5 years after she started initiating her symptoms, she actually stopped having menstrual periods. And 10 years later, she sustained a fracture in her arm and was diagnosed with low bone density, which is one of the risks of estrogen coming early menopause. And so, as I counsel patients, I give them three pieces of advice to feel really empowered in this journey. The first, be educated. Understand what's going on in your body. There are so many different influencers and books and frankly websites that talk about menopause. For many of us, especially as we're getting into our mid 40s, we're dealing with a lot, whether that's launching children off to college or becoming caregivers for our parents or rising in our careers, that it almost feels easier to put your head in the sand and kind of wish perimenopause away. But I encourage you to read and understand what's happening in my body. The second thing is then partnering with someone like me, a menopause practitioner, to fully understand what your options are, especially if you're having bothersome symptoms that are frankly very disruptive to your life. And here is the thing, if you have someone, and it could be very well your physician who helped you bring your children into the world, if you don't feel like you're heard, if you don't feel like you're actually given the attention and being having your goals addressed, I want you to find somebody else. On menopause.org, there's a whole directory of people just like me across the United States that you can find and have a consultation with to better understand what your options are to navigate through this transition. And then number three, I highly, highly recommend doing this in community. That's right. That book club that you have every month with your girlfriends, I want you to have one completely centered around perimenopause and the menopausal transition. If you have friends who are around your age category, trust me, they're going through the same thing you're going through. No one's talking about it. So be a leader in this space with your friend group and talk about menopause. Maybe you gather together over a book, or maybe you go to an event together so that you can better understand what's happening in your body so that you don't go it alone.